Why does your newborn need these three screenings in the first few days of life? Well, let's look at these. First is the newborn metabolic screen. Now, if these metabolic conditions are not detected early and treated, there can be some serious issues with your baby. So, babies can develop autism, there can be developmental delays, muscle weakness, seizures, intellectual disabilities, and even death. So, what does this screening test for? There's like over 50 disorders depending on your state, and it tests for like PKU disease, sickle cell anemia, hypothyroidism, and ones you've probably never heard of before, like maple syrup urine disease. Now, how is this done? The metabolic screening is done with the heel stick from the baby to get some drops of blood, and then that's dried on a piece of paper, which is sent to your state lab for testing, and that's obtained like between 24 and 48 hours of life. Secondly, the newborn critical congenital heart defect screening. This is also very important. Now, you may have had all your prenatal ultrasounds, and they do examine the baby's heart with that ultrasound, but sometimes things can still be missed. So, early diagnosis there again can prevent problems, even death. So, how is this screening done? So, it is done with checking the baby's oxygen saturation using pulse oximetry on the baby's hand and feet. And that's because babies with congenital heart problems will have less oxygenation in their bloods. And then third, newborn hearing screen. This is also very important. So babies and children that have a hearing loss can have problems with understanding others, which can affect their speech. They can have delayed speech and language skills. They can have learning problems in school. They can have negative feelings about themselves. And it even can affect the relationship with their family and friends. Now, your baby may startle in response to sounds, but that doesn't mean they don't have a hearing loss. They could still have trouble hearing. And so the newborn hearing screen is done within 1 to 2 days of birth, and it measures the response to sound either in the baby's brain, for instance, or the hearing nerve, or in the ear. And you can see in this picture an example of how it's done. If you'd like to find out more, check out my childbirth education classes in the link in the description. Thanks.